Hello, ladies and gentlemen. Welcome to Triple N Media COVID-19 World News. I am Dr. NIK NIKAM, and this is November 14, 2020. Before we proceed any further, I would like you to take a look at my book on COVID-19 pandemic 2019-2020, an international and a personal guide to a pandemic. Check it out on Amazon.com and please leave your comments. So let us begin with the feature presentation. As of November 13, there have been more than 53.2 million cases of COVID-19 reported all across the globe, resulting in 1.3 million deaths. Here's a graph showing that more than 600,000 cases are reported each day all across the globe, and the mortality, which had come down during the first peak, has gone up during the second time, and it is continuing to go up as the number of cases have skyrocketed. More than 600,000 cases per day. So the worldwide mortality is around 10,000 cases per day. In the United States, we have 10.87 million cases of coronavirus reported, resulting in 248,585 deaths so far as of November 13, 2020. More than 6.7 million people have recovered from this coronavirus infection. If you look at the graph, it gives you a much better picture of what is happening as far as the trend is concerned. Back in March and April, we had the first wave, which was having a case rate of like 30 to 40,000 cases per day. During the second wave in June, July, and August, when the lockdowns were lifted, we had cases close to 75,000. Now in the United States, we are seeing a steep rise in the number of active cases, going close to 150,000 new cases per day. But if you look at the mortality chart, it tells a different story, not only here in the United States, but all across the globe, and especially in Europe, as we will explore in a few minutes. The mortality, which was in the range of almost 2,500 deaths per day during the first peak, is considerably less now, even though the number of cases have gone up by fivefold. Even though there has been a 500% increase in the number of new cases, the mortality is 50% of what we saw in March and April. So let us keep that point in mind, because that is an important number to remember as we explore more things. In India, we have 8.7 million people with a diagnosis of COVID, resulting in 128,722 deaths, whereas 8.1 million people have recovered. In India, you're seeing a wave that started back towards the end of March, reached the peaks somewhere around the middle of September, but it is still in the downslope wave, and it is flattened during the last 3 to 4 weeks. So India hasn't even completed the first wave, as 65% of the population in the United States is of European descent. So we can compare the case mix in Europe to that of the United States to get a better understanding of how the United States compares to the European Union countries. Let's look at France. The case reports were almost like 5,000 or so, but right now they're having a case report of 50,000. The number of cases during this second wave in France is anywhere from 6 to 10 times higher than what it was in March and April. But look at the mortality here in March and April, which was up to 1,500 cases per day. but with a 6 to 10-fold increase in number of active cases, the mortality is half of what it was in March and April. So there is a clear dichotomy between a steep rise in the number of active cases with a much lesser mortality compared to what we saw in March and April. We are seeing similar pictures in the United Kingdom and also here in Italy and Germany. So let's look at some of this in a little more detail. In United Kingdom, they had approximately 5,000 active cases during the first wave. Now they are having 30,000 cases, which is almost like 4 to 6 times that of what they had in March and April. But look at the mortality again. With a 6-fold increase in number of active cases, the mortality is less than 50% of what it was in March and April. We had the same story here in Italy. Even though Italy, it went from like 7,000, 8,000 to almost 40,000. Italy is one country where the mortality is sort of peaking, and Italy also has a higher percentage of older population with multiple risk factors like hypertension, diabetes, and heart disease. Here's the case in Germany where we see a similar steep rise in the second wave, but the mortality is much less than what it is compared to that. This clear dichotomy between a steep rise in acute cases with no appreciable increase in mortality or less mortality compared to March and April has been coined as case-demic. We are seeing a lot of new cases, but they don't correlate with the mortality we saw in March and April. The test that is most frequently used to detect the coronavirus is the PCR test. But unfortunately, the PCR test detects the live virus, the dead virus, and virus RNA fragments. So basically, when we have this high number of cases detected by this PCR test, it doesn't tell you what percentage is really spreading the disease. And that may be one reason why we are seeing a substantially less number of deaths compared to the astronomical number of new cases reported all across the globe. If you look at this chart here, it talks about the United States, for example, has 11.2 million cases, but United States has done 166 million tests. More than half the population of the United States already have been tested. In India, with a population of 1.3 billion, they have tested 124 million patients. Here are the countries reporting the highest number of cases. As you can see, United States with 157,000 new cases as of November 13th. But nonetheless, if you look at the other countries, which are 1/5 the size of the United States, for example, France and Italy, all these countries, the number of new cases in France, Italy, and UK are pretty close to what the number of new cases in the United States is based on the population size. That's an important point to keep in mind because United States population is 5 to 6 times that of any European country. Of course, there have been lockdowns or localized lockdowns implemented in Germany, United Kingdom, Italy, France, many states here in the United States like California, Oregon, and other states, Belgium, Poland. All these are to contain the virus spread. Let's talk about vaccine. We had some great news this week. First from Pfizer, which announced the preliminary results of a phase 3 trial, which showed a 90% reduction in the infection rate in the patients who received the actual vaccine. This is a summary of the report given by the White House briefing. The vaccines based on messenger RNA technology, Pfizer we talked about. Moderna is also going to announce its preliminary results next week. when they pre-announce that they are going to announce, that means they probably have good news. The vaccines based on the vector technology come from J&J, which is in phase 3 trial, now recruiting a lot of volunteers. While we are on the topic of volunteers, we encourage everyone to participate in these trials so that they can finish their trial and we have more options available to reach a much larger population of the world. Similarly, Oxford AstraZeneca, which was the first one to start the phase 3 trial, is just about completing its recruitment, and we will know the results in a few weeks. The vaccine based on recombinant protein technology is from Novavax, which will start phase 3 trial. There's a typo here, in a few weeks. The United States military, along with the United States Postal Service, the FedEx, and the manufacturers, has this Operation Warp Speed, which will be distributing the vaccines throughout the country. According to the head of the task force, they will be distributing close to 20 million doses of vaccine in December. And starting in 2021, they will be able to distribute 20 to 25 million doses of vaccine each month. The healthcare workers, the most vulnerable people, will be the first group of people to receive the vaccine. On the antibody side, Eli Lilly received an emergency use authorization for its monoclonal antibody, Belantamab, which is available now in Texas, free of cost to anyone with the COVID infection. The Governor, Greg Abbott, emphasized the earlier we give these antibodies, the better are the chances of fighting this virus and preventing it from creating more complications. So, ladies and gentlemen, before I conclude, I would once again like to invite you to take a look at my book on COVID-19 pandemic, which has more than 37 different chapters covering various aspects of a pandemic. This will be a great resource for leaders, for healthcare advisors and administrators, for university administrators, anyone who is in a leading position to deal with COVID patients at workplace or others. Would be quite benefited by getting a broad general knowledge of what a pandemic is and how do you protect your members and how do you protect yourself. Ladies and gentlemen, this has been a presentation of COVID-19 World News, November 14, 2020. I am Dr. NIK NIKAM from Houston, Texas. Please do subscribe to our YouTube channel and we will see you next time.